Last week, a patient sat in front of me and said something I hear all the time. I don't feel right. I'm tired. My thinking is slow. My energy crashes in the afternoon, and I just don't feel like myself. Then she paused and added, but my doctor said my labs are normal. That word normal sounds reassuring. It sounds like a green light. It sounds like everything is fine. But here's the problem. Normal does not mean optimal. And it definitely does not mean healthy in the long term. Most people never question that word. They assume if their labs fall inside the reference range, their body must be functioning correctly. But that assumption is one of the biggest reasons people stay stuck, feeling tired, foggy, and slowly declining without a clear answer. To understand this, you need to know how normal lab ranges are created. These ranges are not based on the healthiest people in the world. They are based on large populations. Those populations include people of all ages, people with obesity, people with diabetes, people with heart disease, and people already on the path toward chronic illness. The only individuals excluded are those with severe or extreme abnormalities. So what does normal really represent? It represents average. And average today is not healthy. Average today is metabolically compromised. Average today includes early disease. That means you can sit comfortably in the normal range and still be moving in the wrong direction. Let's make this simple by looking at blood pressure. Years ago, a reading of 120/80 was considered the standard for a healthy adult. Over time, as populations became heavier, more sedentary, and more metabolically damaged, average blood pressure increased. Eventually, readings like 140/90 became common enough that they started to be treated as acceptable for certain age groups. Doctors would say, "That's normal for your age." But it wasn't normal in the sense of healthy. It was normal in the sense of common. And studies like the Framingham Heart Study made something very clear. Even small increases in blood pressure significantly raise the risk of heart disease and death. The body doesn't care about population averages. It responds to physiology. This is the difference between normal and optimal. Normal means you are not at the extreme edge of disease. Optimal means your body is functioning at a level that protects you from disease. Now let's apply that thinking to common lab markers, because this is where most people get misled. Start with vitamin D. Many labs will show that a level above 20 is sufficient. That number came from preventing a disease called rickets. It was never designed to represent optimal health. Vitamin D is not just a vitamin. It acts like a hormone. It enters your cells, interacts with your DNA, and influences how proteins are made. Those proteins affect your brain, your immune system, your muscles, and your metabolism. When vitamin D is low, those systems don't function at full capacity. You may not notice it immediately, but over time, you begin to see subtle signs. Lower energy, weaker immunity, slower recovery, changes in mood. In my practice, I aim for a vitamin D level of at least 50. That is where I consistently see better brain function, stronger immune response, and improved overall performance. When levels drop into the 30s, which is still considered normal by many labs, people often report feeling off without a clear explanation. Now look at triglycerides. The standard reference range says anything below 150 is acceptable, but metabolically, that is far from ideal. Triglycerides are a marker of how your body is handling energy, especially carbohydrates. When they start to rise, it is often an early sign of insulin resistance and metabolic dysfunction. In a healthy system, triglycerides should be well below 100. Personally, I prefer to see them in the 60 to 70 range. When they begin creeping into the 90s, it usually reflects an increase in carbohydrate intake or a decline in metabolic flexibility. By the time triglycerides reach 150, the body has already been under stress for a long time. Next is fasting blood sugar. The normal range is often listed as 70 to 99. Again, this is based on population data, not optimal physiology. When you track patients over time, you start to see patterns. As fasting blood sugar rises from the low 80s into the high 80s and low 90s, subtle metabolic changes begin. Energy becomes less stable. Fat storage increases, inflammation quietly builds. By the time someone is consistently in the high 90s, they may still be labeled as normal, but they are often on the path toward prediabetes. And this stage can last for years, even decades, without triggering any alarms in standard medical checkups. Optimal fasting blood sugar is typically between 70 and 85. That range reflects a system that is handling glucose efficiently and maintaining metabolic balance. There is also an important nuance here. In individuals who are adapted to using fat as fuel, such as those following a ketogenic approach, blood sugar can sometimes drop into the 60s or even high 50s without symptoms. In that context, low blood sugar is not necessarily dangerous because the brain is being fueled by ketones. The key factor is not just the number, but how the body is functioning with that number. Now let's talk about ferritin. This is a marker of stored iron in the body, and it is one of the most misunderstood labs. The reference range is wide, and both low and high levels can create problems. When ferritin is too low, the body lacks the iron needed to produce key neurotransmitters in the brain. This can affect focus, memory, and mental clarity. Many people with low ferritin feel tired and foggy, even if their hemoglobin appears normal. In my approach, I do not like to see ferritin below 50. That is the level where I consistently see better cognitive performance and fewer symptoms related to low iron stores. On the other side, high ferritin is also a concern. Excess iron contributes to oxidative stress, which accelerates aging and increases the risk of chronic diseases. When ferritin remains above 140 for extended periods, I begin to look closely at strategies to bring it down and reduce that stress on the body. This is where the concept of optimal becomes critical. It is not about avoiding extremes. It is about finding the range where the body performs best. When you look at all of these markers together, a pattern emerges. Disease does not suddenly appear overnight. It develops slowly, often within ranges that are still considered normal. The body gives subtle signals long before a diagnosis is made. Fatigue, brain fog, low motivation, poor recovery, and fluctuating energy are not random. They are often early indicators that something is not optimal at the cellular level. The problem is that standard lab interpretation is designed to detect disease, not to optimize performance. It answers the question, are you severely ill? It does not answer the question, are you functioning at your best? That gap is where many people get lost. They feel something is wrong, but they are told everything is fine. Over time, they begin to doubt their own experience. But your body is giving you information. The challenge is learning how to interpret it correctly. When you shift your perspective from normal to optimal, everything changes. You start looking at trends instead of single numbers. You start asking how your body feels in relation to those numbers. You begin to see connections between your habits, your metabolism, and your lab results. This is not about chasing perfection. It is about understanding direction. Are you moving toward better function, or are you slowly drifting toward dysfunction? Small changes in lab values may not trigger concern in a standard system, but they matter over time. A fasting glucose creeping from 82 to 95 is not just a number, it is a signal. Triglycerides rising from 70 to 110 is not just a fluctuation, it is a message. Vitamin D sitting at 32 instead of 55 is not just a detail. It is a difference in how your cells are functioning. When you start to see these patterns, you realize that health is not static. It is dynamic. It responds to your diet, your sleep, your stress, your movement, and your environment. The goal is not to wait until something breaks. The goal is to maintain a system that functions efficiently over time. That is why understanding the difference between normal and optimal is so powerful. It shifts you from a reactive mindset to a proactive one. It gives you the ability to make adjustments before problems become permanent. If you feel tired, foggy, or not like yourself, and you have been told your labs are normal, do not stop there. Look deeper. Ask better questions. Pay attention to where your numbers fall within the range, not just whether they are inside it. Because normal is based on a population that is already struggling. Optimal is based on how the human body is designed to function. Your body is not confused. It is responding to the inputs it receives every day. When those inputs improve, the outputs improve. When the internal environment is supported, energy returns, clarity improves, and resilience increases. The difference between feeling average and feeling your best is often hidden inside those small gaps between normal and optimal. I'm Dr. Sean Dozbo, and now you understand why normal labs don't always mean you're healthy.